Hello everyone, my name is Baby Escalera and welcome to my outreach reporting presentation, which I chose to focus on the current prevalence of diabetes in Mexico. Mexico has declared the epidemic of diabetes a national emergency and is seeking to improve the quality of care for about 13 million people with this disease. The country I chose to focus on for this project, as I mentioned, is Mexico. Mexico is very near and dear to my heart. I am Mexican and I visit very frequently to family members, which I still live down there very often. So this is a topic that I wanted to touch on and hopefully bring awareness to. Mexico is currently facing a healthcare crisis with diabetes. Mexico suffers from higher rates of disease than residents of other industrialized nations. Patients are far more likely to die of preventable conditions due to chronic lack of government investment in the healthcare system. And I just want to add here too, for lack of population education on diabetes. Just a little bit about the disease. Type 2 diabetes is a leading cause of death and disability combined in Mexico. Mexico has been fighting the epidemic on three fronts, which are the public health, medical care, and fiscal and regulatory policies, which is the Mexican government lack of focus on healthcare in Mexico. About 13 million people, as I mentioned, aged over 20 years of age in this Latin American country of 121.5 million people are living with diabetes, but only 50 to 60% of them have been formally diagnosed. Many Mexicans are diagnosed with diabetes at a relatively early age, with about 3.25% of cases detected between 20 and 39 years of age. Some of the efforts to combat disease are the country has taken steps to improve its first line of defense, which is prevention, through soda taxing and public awareness campaigns throughout the entire country. Early detection and primary care level are their main concern right now, and to educate the very rural areas, villages that may not even have electricity yet or even a healthcare facility. Improving quality of care. Since 2004, Mexico has extended healthcare coverage to 52 million previously unenrolled Mexicans through the Seguro Popular program. And this is one of the three organizations that I researched. The first one is International Diabetes Federation. The IDF has conducted many studies throughout the world and specific areas where diabetes is more prevalent, such as Mexico. The IDF is a worldwide alliance of 230 national diabetes associations in more than 160 countries. Their goals are primarily to promote diabetes care, prevention, and cure worldwide. Some of their strategies are that they seek to partner with responsible corporations, and some of their practices are that in 2017, the IDF, in partnership with Novo Nordisk, initiated the Taking Diabetes to Heart study to assess knowledge and awareness of CVD among people with type 2 diabetes. Some of the challenges that IDF faces are availability to access to healthcare and pharmaceuticals throughout the country. The IDF is still trying to reach as many rural villages as possible to spread this diabetes awareness. The World Diabetes Foundation, some of their goals are to empower the governments and civil society and other non-state actors who strive to deliver global commitments through the national and local action. They link people to resources and educate and provide care locally. Their priority is to support the poorest of the poor population. Some of their practices to achieve this, they create partnerships and act as catalysts to help others do more. They encourage and fund innovative projects and strategies to prevent and treat diabetes. Some of the challenges that the most vulnerable population are those without health insurance and low-resource families, single mothers, people working informally, and the elderly. This foundation and its projects essentially represent their only hope for detecting and treating diabetes. The last organization here is the Non-Communicable Disease Alliance, and their goal is to seek to ensure that WHO, or WHO, commits to improve the lives of people with non-communicable diseases and those at risk that are followed up and implemented at regional, national, and local community levels. The NCD Alliance maintains relations with the World Health Organization governments to put forefront elevating NCDs onto global healthcare and development priority. They focus on nurturing and enabling strong, sustainable alliances that bring together different organizations to advocate on common issues such as diabetes. Some of my professional strengths, interests, and objectives here. Some of my strengths that I consider are communication, determination, and administrative work. So more personally, communication and determination. I've always prided myself on having very open communication, clear and concise, and ongoing communication with my superiors, my peers in school, my personal life, and my work life. I'm bilingual, which I find helps a lot. I can help others who may not understand the language. I can step in and help them. And I'm very determined. I always set a goal, and I try to do my best to reach that goal within the desired time frame. And I have a lot of administrative work, which is what is helping me, hopefully will help me land a good career after graduation. My interests are public health, environmental health, and helping my community. I live in a very small, well, not so small, but smaller town in central Washington, and we're very community oriented, very focused on growing, empowering those in our community, and I hope to get into some programs, maybe an organization that is also very community oriented. Some of my objectives are to obtain an executive position that will allow me to improve quality care, that being in any kind of organization. I would love public health mainly, to obtain that managerial executive position and to be able to be a part of improving care, which I think there's always room for. I also, after graduation, at some point, hope to obtain a master's in health administration degree. This is just one of my long life goals, and I hope to be able to do that shortly after graduation. Some of the current diabetes interventions in Mexico are that I can help with in the future, and I think that I can be involved with, is spreading awareness, as I mentioned at the beginning. I am Mexican, and I have very many family members who unfortunately have or suffer from diabetes, and I've seen this increase over the years while I visit to Mexico. So from my part, I can help spread awareness, to my family, to my community down in Mexico, even through social media. I can post link videos and hopefully just make people aware of this disease and all the adverse effects that it can have. I can educate them on healthier eating habits, and encourage physical activity as well. Like I said, to my family members, to those that I have on social media. Even when I go down to Mexico, I can talk to them And this picture here of this older lady drinking a Coca-Cola bottle, I feel is so correct. Drinking soda in Mexico is, you cannot have a meal without soda. So I think one of the steps towards against diabetes is the tax that they made on soda, because it is one of the places in the world where they drink the most soda. So this is one of the things where I can also advocate for. And also lobbying for safer and healthier public places to exercise. There aren't very many gyms in Mexico unless you're in a bigger city, so I think somewhere in the outdoor area where it's clean, there's not that much pollution, and it's safe to exercise outside. I think that's something that I could help with when I'm down there. Maybe a quick project to do while maybe gather some other people who are interested too. That would be something that I would really enjoy. And here are my references. Thank you so much for watching. I hope you enjoyed my presentation.